Okay, good afternoon, students. In the last class for physiology practical, we have discussed about means what they mean by blood pressure and what is the normal blood pressure. Solid. And in what are the two instruments used for measuring, used for checking blood pressure? We discussed now. So two instruments we use for measuring blood pressure, that is digital blood pressure monitors, okay, and sphygmomanometer. So in the digital blood pressure monitors, there are different parts. Okay, so the first is cuff, CWF cuff. So in this cuff, what happens? We usually put this cuff here in the upper arm. Okay, in the upper arm side, we usually put this. Then in this monitor, digital monitor, what do we see? We see all this. Okay, all this, and the first reading, you can say the first reading is for systolic blood pressure. Okay, and the second reading is for diastolic blood pressure. This one, second one, and the last one is for pulse rate. Okay, for checking your pulse rate, I mean, it will automatically come. Okay, you'll press the power button and it will automatically open. But one disadvantage of this is that it doesn't need to come accurate. Okay, it doesn't come accurate mostly in patients who are having atherosclerosis, means the person who are having abnormal heart means rate, okay, rhythm. So it happens mostly in those people. Okay, are you clear? Are you clear about this?
Can you repeat again?
This is digital blood pressure monitor. Okay, so in this blood pressure monitor, we usually measure means it automatically comes out from the name itself, digital. Okay, so this is cuff. So this cuff we place in the upper arm. Okay, this side, the forearm, you can say. You usually place this. Okay, this cuff. Then what happens when you press the power button? Okay, this is the power button, and when you press, what will appear in the screen, in this digital screen? All this will appear in the screen. Okay, so the first thing which will appear in the screen, okay, the uppermost part, we see as, or else the reading is known as systolic blood pressure. Okay, systolic blood pressure. And the second reading, okay, the second part you can say is diastolic blood pressure. Okay, the second reading is the diastolic blood pressure. And the third one, okay, this is the third one or the last one, it's the pulse rate. Okay, so these are the things which you'll find in the digital blood pressure monitors. Okay, did you understand, everyone? Yes, did you understand?
Yes, ma'am.
Okay. And the next is sphygmomanometer. So this is the sphygmomanometer. So in this sphygmomanometer, you will find the readings. Okay, just like in the ruler, in the scale, what we see the readings or not, centimeter, all this, or even measuring tape, and also the readings are there, na, for you to know. It's not it. So in the same way, in this manometer also the readings are there. Okay, this part. Here we will be where here we will be able to know the person's, this one, blood pressure, means by with the help of this reading. Okay, this reading is known as what, column of mercury, indicating pressure. Okay, column of mercury indicating blood pressure. This part. Okay, so in this what okay, so this is the reading. Then the second part, okay, the second part, or the next part, you can say it is cuff. C double F cuff. So same thing, even in this cuff also, you will place the cuff in the upper arm. Okay, it means in this side you will place the cuff in the upper arm. Okay, and this is air valve. Okay, so this is the air valve. In this air valve, you will be able to control the air, the pressure of the air. Okay, from here you squeeze it. This is the squeezable bulb, you can say bulb. So in this bulb, what you will do, you squeeze the bulb so that the air will push inside. Okay, so that this cuff will become tight. Okay, it's loose. Remember, it is loose. So for this cuff to get tight, you need to give air, insert air in this with the help of this bulb. Okay, you squeeze the bulb, then with the help of this air valve you will be able to control the amount of air which you are squeezing. Okay, and as it will go, this cuff, it will become tight. Okay, this cuff, it will become tight, and what you will do, you will have to place this stethoscope. This is the stethoscope. Okay, so this is the stethoscope, this diaphragm, this is the diaphragm. Okay, this part is known as the diaphragm. So the diaphragm you need to place just above brachial artery. Okay, brachial artery is here. Okay, so brachial artery is there. So just above this you'll find, you'll place the diaphragm in this brachial artery. Okay, did you understand? So in this way, you can measure your blood pressure. Did you understand? Did you understand?
Ma'am, repeat.
This is sphygmomanometer. Okay, the instrument used for measuring blood pressure is known as sphygmomanometer. Okay, so this is the sphygmomanometer, and this is the findings or the readings, you can say, from where you can see. Okay, from where you can know uh, the the blood pressure. Okay, so what you will have to do, when you will squeeze this bulb. Okay, when you will squeeze this bulb, what will happen? This is the bulb. Okay, in this manometer you will get this bulb. When you squeeze this bulb, no, the air will pass in. Okay, the air will pass in, and this cuff will be, means, puff out, means it will be inflated. Okay, means it will get tight. Understand? And this is the air valve. So with this air valve, you will be able to control the air which is coming in. Okay, so, and after that you will measure. Okay, means after that you will measure it with the help of what? With the help of stethoscope. So this is the stethoscope, and you'll place this diaphragm. Okay, this is the diaphragm, and with the help of this diaphragm, means, you'll have to place the diaphragm in your brachial artery. So this, you remember, na, brachial artery, from where you can feel your pulse. So this is your brachial artery, and you'll place this diaphragm above this brachial artery. Okay, then you will start squeezing the bulb. Okay, you will start squeezing the bulb. Then what you will have to do, uh, you will hear a sound. Okay, as soon as you, this one, you will squeeze the this one bulb. What you will get, means, from the stethoscope that is in the ear tips or the earpiece, you will get one sound. Okay, you will get one sound. The first sound which you will hear is known as the systolic. Okay, systolic blood pressure. Then you will keep on waiting. Okay, then as the sound, as you hear the sound a bit less, okay, it will go and relaxing. So that pressure is known as diastolic blood pressure. Okay, you will be able to know it only like when you will do. Okay, for now I can't come and distribute a stethoscope and this sphygmomanometer to each and every one of you, isn't it? So all these things now you will come to know only if you practice, if you understand. So, but I'm just saying it to you means when you place this diaphragm, this is a diaphragm, okay, in the brachial artery, you have to inflate this in the, you have to squeeze this bulb, okay. As you squeeze the bulb, what will happen? Uh, you'll place this stethoscope in your earpiece, just like headphone in both sides of your ears. You will place it. Then afterwards, what will happen? As when you will squeeze the bulb, okay, when you squeeze the bulb, what happens? You will hear a sound. Okay, means that sound is what? The heartbeat. Okay, the means the beat, your heartbeat. There is the heartbeat, and the first sound which you hear, okay, is known as the systolic blood pressure, and as means even this mercury also, in this marking, it will go down. Suppose 120. Okay, can you see this arrow? So suppose it reach here. So suppose your blood pressure is. Can you see this? Can you see this, students? Yes, can you see it or not?
Yes, ma'am.
Okay. So, yes, Yatulika, can you hear me now?
Yes,
Yes, Yatu, can you hear me?
yes, ma'am. I can hear you.
Okay, okay. So this is the readings. Okay, so what will happen? Inside mercury is there. You remember na Hg? Hg means mercury. So what will happen here? As you will squeeze the bulb. Okay, the air will go in. The air will go in, and afterwards, what will happen? You'll have to place this diaphragm in the brachial artery. Okay, this is your brachial artery, and you'll have to place this above your brachial artery, and you'll have to insert, okay, insert this earpiece, okay, inside your ear you need to insert it, just like earphone, no headphone, you have to insert this one. This is stethoscope. You'll have to insert this. Okay, means you have, suppose this is your earphone, so you'll have to insert like this, the stethoscope. Okay, you'll have to insert it. Then you'll have to place. Okay, I'm just showing you this one, my charger. Suppose you say this is a diaphragm. Okay, and you have to place a diaphragm here. Okay, in your brachial artery, just above your brachial artery, and the cuff should be here, upper side. Okay, then afterwards, what you will do? You will squeeze uh, the bulb, and after squeezing, what will happen? This is the mercury. Okay, this is the mercury, and as you keep on squeezing, what will happen? The mercury level also, it will go on rising up. Okay, as you squeeze the bulb, the mercury level also, it will go and rise up. Okay, and suppose your BP is 120 by 80. Okay, normal BP is 120 by 80, and as you as you insert, as you squeeze the this one bulb, what will happen? The readings, no, this one, it will raise up. It will raise up, and suppose you heard a sound. Okay, suppose you heard a sound. The first sound comes here. Suppose 120. Okay, 120. So that one is known as systolic blood pressure. The first sound which you will hear, it will be dhak 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 like this. Okay, the sound will be like that, means heartbeat. So the first sound, suppose you means you got it in 120. Okay, so that sound is known as systolic blood pressure. Okay, the first sound which you will hear is known as systolic blood pressure, and the mercury also, it will go on coming down like this, it will come like this, down, 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 to come like this. So when it will come down, the sound also, it will get lesser and lesser. Okay, it will get lesser and lesser, and the last sound which you will hear is known as diastolic blood pressure. Okay, the last sound which you will hear is known as diastolic blood pressure. Suppose it stop at 80. Okay, suppose it stop at 80, and that sound will be known as diastolic blood pressure. So it will be 120 by 80 mm of Hg. Okay, okay, did you understand? Did you understand or not? Yes. Did you understand or not, students?
Yes, ma'am.
Little bit, ma'am.
Little bit. Actually, now all these things, if you perform in life, if you perform in practical, like you will be able to know it more clearly. For now, to like what to say, means just by virtual class, it will be a bit difficult for you. Actually, you yourself, you will have to do it. Okay. So one thing you can do is that if you go for checkup and all, doctors checkup and all, okay, they will BP. If they'll check your BP, you will just come to know it. They'll put a cuff in your hand. Okay, the doctors or the nurses, they will put a cuff in your hand, and afterwards they will means they will squeeze the bulb. Okay, and as they squeeze the bulb, even the cuff also will get tighter and tighter. Okay, it will get tight. Means so that it won't fall. No, means it will get tight the cuff. Then as you put the diaphragm, suppose this is the diaphragm of the stethoscope, you'll put the diaphragm here in this brachial artery. Okay, in this brachial artery you will put here, and after that you will put the earpiece, okay, inside your ear, which is in the stethoscope. Then afterwards, as you feel like it's enough, what you will have to do, you will have to control, with the help of this ear valve, you can control the this reading. Okay, you can control it. Then afterwards, suppose as you inflate air, okay, even the mercury level also will go on rising, will go on rising up. Okay, it will rise up. Then what will happen, you will hear a sound. Suppose you heard a sound in 120. Okay, dhap dhap dhap, you will hear like that. So the first sound which you will hear is systolic. Okay, then as it goes down, okay, means it will go down, obviously it will go down. Okay, it will go down. Then suppose the sound became less. Okay, obviously the sound will become less. Then the last sound which you will hear is known as diastolic blood pressure. Okay, so that is about it. So these are the parts of stethoscope. Okay, the first part is earpiece or ear tips also, you can say, which you'll put inside your ear, and this one is known as binaural. Okay, binaural, this part, and this one is known as binaural string. Okay, this part is known as tubing. This whole part is known as tubing. This one is known as bell, bell, bell. Okay, and this part is known as diaphragm. Okay, and this part is also known as chest piece also. Okay, chest piece also it is known, and this is the bell, this part. Okay, and this is your diaphragm. Okay, so this is the part, these are the parts of stethoscope. Okay, okay, did you understand everyone how to measure?
Yes, ma'am.
Okay, Okay, so in blood pressure, you can see that hypertension and hypotension. Okay, hyper means what? High. Okay, your blood pressure will be high. Understand? So we will discuss about hypertension for now. So the normal temperature is how much? 120 by 80. Okay. So and if it gets a bit elevated, it's okay, no problem. Okay, 120 or else from 120 to 127. Okay, that is the systolic blood pressure. And if it is less than 80 also, till here it's okay. Okay, till here it's okay. But if your temperature, sorry, not temperature, if your blood pressure, it will rise. Okay, that is maybe 130 by 80. Okay, maybe 131 by so and so. Okay, so that one is known as hypertension stage 1. Okay, so that one is known as hypertension stage 1. Okay, and this one high blood pressure stage 2 is how much from where? 140. Okay, 140 or else higher. And lower part, that is the diastolic pressure, it will be 90. 90 or else more than 90. Okay, and the last one, that is the most serious one, it is 80, 180. 180 by 120, or else it will be higher than that also. Okay, did you understand about this? Hypertension means blood pressure will be high. From the name itself, hyper means up, above. Did you understand, everyone? And
Yes,
this,
ma'am.
okay, and this is low blood pressure means hypotension. Okay, hypotension, it starts from where? Usually it starts from 90 by 60 mm of Hg. Okay, and if the person is having 80 by 60 mm of Hg, then the person will feel nausea. Nausea means feeling of vomiting. Okay, the person will feel like vomiting, urge to vomit. That one is known as nausea. And dizziness, the person head will go round. And if the person is having 180 by 50 mm of Hg, then the person will faint. Okay, behosh ho jayega, and the person will get tired. Okay, and if the person is 70 by 50 mm of Hg, the person will be weak. Okay, and blurry vision means the vision won't be clear, it will be blur. Okay, if it is 60 by 45 mm of Hg, then the person will be sleepiness. Okay, and confused. And if it is 50 by 35 mm of Hg, very this one, coma or death. Okay, pura loss of memory, and it will be like, it will ultimately lead to death. Okay, so I'll explain to you about all this. So first, let's see hypertension. Okay, hypertension means pressure will be high. Okay, pressure will be higher, blood pressure will be high. Understand? The blood pressure gets high. And if your blood pressure will get high, what will happen? It will lead to many complications. Okay, complications like what? You will have heart disease. Okay, you will have stroke, and um, it will ultimately means the person's life will be lost, means death. Okay, and hypertension, when we usually say it's above 160 by 90. Okay, 160 by 90 mm of Hg. Okay, so this is about hypertension. If we get hypertension, we can get many complications also, like heart disease, stroke, or sometimes it leads to death also. Okay, and in this blood pressure symptoms, what symptoms can we get?
Screen.
Can you see the screen, students?
Yes, ma'am.
Yes. Okay. Can you see now, Sakani?
No, ma'am.
What about others? Can you see or not?
Yes.
Yeah, your other friends they can see. What happened? I think we have network issues. I think. Okay. So in this high blood pressure, okay, if the person's blood pressure will be high, so what are the symptoms that we can see? You can see that the person will feel dizzy. Dizzy means the head will go round. Okay, the person might faint. Okay, he will lose his consciousness by fainting, and the person will have headache. Okay, so all these things he will have means upside. I'm talking about upside part. And in the eyes, what will happen in the eyes? Blurred vision means the vision won't be clear. Okay, whatever he or she is seeing, everything will be blurred. It won't be clear. And next is the person might have nose bleeding also. Okay, the person nose might bleed. And next is what? Chest pain and angina. Same thing, chest pain and angina. Angina also like it's a pain in the chest. Okay, and the person's chest will pain. Okay, okay, and this arrhythmias. Arrhythmias means uh, the rhythm of the heart. Okay, that means the beating of the heart. It won't be regular. Okay, it will be abnormal. Okay, and the person will have difficulty in breathing also. Okay, the person will have difficulty in breathing. Then swollen abdomen means the person's this abdomen. Yes, can you hear me, student? Am I audible? Can you see the screen? Is it visible?
Yes, ma'am.
Okay. So the next is what swollen abdomen means the person abdomen. This is the abdomen. Okay. It will swell up. Means it will come out. Puff out will come out. Okay. The size will be bigger. The size of the abdomen will be bigger. Okay. And next is what fatigue. Fatigue means weak. Means the person will feel weakness in the this leg area, in the lower extremity. The person will feel weak in this lower extremity. That is known as fatigue. Fatigue means weakness. Okay, and next is edema. Edema is swollen in the feet. Okay, the person's this leg part, no, this feet part, it will be swollen. It will swell up. Okay, so these are the symptoms which you will find during blood pressure. Means during high blood pressure. Okay, did you understand? Many complications, isn't it? Okay, did you understand? Yes, did you understand or not?
Yes,
Ma'am,
ma'am.
can you repeat again?
Okay, first part from your head. Let's start from the head. Okay, so in the head, if the person have high blood pressure, what are the symptoms which you will find? Those are dizziness, fainting, and headaches. Dizziness means what? The person head will go round. इसको चक्कर आएगा. Okay, fainting means बेहोश, बेहोश होगा. ठीक है, and headache इसका सर दर्द होगा. ठीक है, समझ में आया? The person head will go round, and the person might faint also. Okay, and the person will have headache means the head will pain. Okay, so eyes, in eyes, what will you get? Blurred vision. Okay, the vision, whatever the person is seeing. Okay, whatever the person is seeing, it will be blurred. It won't be clear. Okay, next, what you will find here, you will find nosebleed. Means the person's nose will bleed. Means blood will come out. Okay, खून निकलेगा नाक से. Okay, you understand? Next is chest pain and angina. Okay, it means the person will have pain in the chest. This is the chest, isn't it? So this part will pain. Okay, next is arrhythmias. Arrhythmias means the rhythm of the heart. Okay, means the function of the heart is not normal. Okay, and the person will have difficulty in breathing. Okay, उसको सांस लेने में तकलीफ होगा. Okay, next is what? Swollen abdomen. Means the person abdomen, okay, the size of the abdomen will be larger, not normal. Okay. Next is fatigue. Fatigue means weak, WEAK के weak मतलब उसको कमजोर होगा. Okay, कमजोर हो जाएगा ये पार्ट पे. Okay, next is edema. Edema means what? Puffiness, or else you can say swollen feet. The person's feet will be swollen, means it will grow in size. Okay. Okay, did you understand, everyone?
Yes, ma'am.
Okay.
Yes, ma'am.
So this hypertension, what are the causes of hypertension? Can you hear me now, Sakani? Yes, can you hear me? So causes of hypertension. Okay, means hypertension is mostly due to what? The first cause is because of what? Smoking. If the person smoke too much, what happens? The person will have hypertension. Okay, next is what? Being overweight or obese. Means if the person is too fat, okay, not normal size, too fat, then what will happen? The person will have hypertension. Okay, and next is what? Lack of physical activity. Okay, lack of physical activity means what? Means if the person is not doing anything. Okay, the person is not doing anything, just sitting, sleeping, eating. Okay, that means lack of physical activity. Okay, so if the person is just sitting, sleeping, eating day, night, what will happen? The person will have hypertension. Okay, and next is what? Too much salt in the diet means if there is too much of salt, okay, in the things which he takes, okay, too much salt in the things which he takes, what will happen? The person might have hypertension. Okay, next is what? Too much alcohol consumption means if the person will have too much alcohol, okay, if the person will have too much alcohol, the person might have hypertension. So these are the causes of hypertension. First is smoking, if the person smokes too much, and second is if the person is too much overweight, means if the person is too much fat, okay, not normal weight, the person can have hypertension. Lack of physical activity means what? Means if the person is not doing anything, just sitting, sleeping, eating, finish. Okay, if the person does like that, the person might have hypertension. Okay, next is what? Too much salt in the diet. Okay, if the person is having too much salt in whatever he is eating or drinking or anything, the person is prone to have hypertension. Next is too much alcohol consumption means if the person will have too much of alcohol, the person can have hypertension. Okay, okay, did you understand?
Yes, ma'am.
Yes,
Okay, next is what? Next is causes of hypertension means what are the causes? Okay, for what this hypertension is occurring? Okay, so first one is what? Stress. If the person is having too much stress, the person can have hypertension. Okay, and it happens mostly to older age, means older people, elderly people. And next is genetics. Genetics means um, it means if your grandfather had hypertension, so you are also uh, means you also have the chance of getting hypertension. Okay, it goes on and on. So that one is known as genetics. If your father is having, then you are also at the risk of having, and your children will also be at the risk of having. Okay, that one is known as genetics. And next is what? Family history of high blood pressure. Same thing, means from your family, if anyone is having, you are also at the risk of having hypertension. Okay, next is chronic kidney disease. Okay, so if the person is having too much kidney problem, okay, kidney problem, that time also the person is at the risk of having hypertension. Next is adrenal and thyroid disorders. Okay, this one too I've already discussed in endocrine glands. Okay, so if the person is having disorders in all those thyroid gland and all, okay, the person can have hypertension. And the last is sleep apnea. Sleep apnea means what? If the person is having a difficulty in sleeping, it's not regular. The sleeping pattern is not regular. Okay, so in that case also the person can have hypertension. Okay, did you understand the causes? Still the causes, everyone?
Yes, ma'am.
Okay, so for today I will end here.